Okay, so we're gonna go over how not to draw a blood gas. So these are some common mistakes that people make when they're first learning how to draw blood gases. One of them is when you go to draw, you want to make sure that this bevel is facing up. So the bevel of the needle is the little hole at the tip, and you want that to face up toward the sky. If you go in facing down, what's going to happen is you're going to go through the artery, through the cannula, the inner part of the artery, and down to past the artery, and you're not going to get the blood. So you always want to make sure that when you're going in, that your bevel is up. Also, when you're holding your ABG syringe, you want your fingers close to the hub. You don't want to be way up here because I have no control over it now. You want to have control, so you want your ABG or your fingers to be close to the hub. So when you go to actually draw a blood gas, you want to have your alcohol. This is so hard to open.
And do not do it with a needle in your hand.
And do not do it with a needle in your hand, because I could have just poked myself. And also, this is iodine. You don't want to use iodine on the radial or the brachial artery. You can use iodine on the femoral, but all you need for the radial and the brachial is your alcohol. So in the previous video, what happened is I alcoholed off the patient, and then I did this and I fanned it. You really shouldn't fan it. You should just let it dry. The reason being is because you can fan bacteria onto the site that you just cleaned. So you really shouldn't fan it, and never blow on it. Another thing that I did wrong in that video is I alcoholed the patient off without alcoholing my fingers. So you should alcohol your fingers if you're going to go and feel again for the pulse, which you should always have your fingers on the pulse. But you do want to make sure that when you alcohol that off, you're also making sure your fingers are alcoholed. So then you're going to feel for a pulse. One thing you're never going to do is draw the blood gas without feeling. So I'm not going to ever do this because I'm probably not going to get it. What I need to do is feel for the pulse. That way I know exactly where that blood is flowing, and you're going to keep your fingers there and you're going to draw blood. Now, let's say I didn't get that and I had to redirect. You're never going to redirect way over. You're only going to redirect like this. So say I didn't get it, you're going to pull back just a little bit, and then you're going to redirect to the middle after feeling to make sure that's where the artery is. Now let's say I felt the artery more toward the outside, toward the thumb. I'm just going to pull back a tiny bit and then move it over just a little bit and then go back in. When you redirect, so I'm in, right, with my needle. When you redirect, you're not going to go straight from being in and then redirect. What did I just do? I just probably cut the inside of their arm, and I could have even severed their artery. So what you want to do is you want to pull back on the needle just enough to redirect and then go back in. Okay, so once you take the needle out, you want to hold pressure. Never, ever, ever recap a needle. So you're going to hold pressure for 5 minutes, but never do this, because it would be so easy for me to miss this and go right into my thumb. And now I just gave myself whatever this patient has in their blood. It could be HIV, could be hepatitis, could be anything. You just don't know. So the only way to be safe really is if you have a safety cap, which we don't have right now. But you can flip that cap over, or you can put this through this red thing. And the very least, if you do have to recap a needle, let's say that this got lost in the shuffle and you really do have to recap it, you're gonna do the one hand technique. You're gonna swipe it up, and then you're going to secure it. Now it's secured. I only did that with one hand, and that's the only way you should ever recap a needle. So once you're done with the blood gas, you're going to take this off. You're gonna put this on, You're also gonna make sure that there's no air bubbles in here. Get the air bubbles out. You're gonna label it. So these kits, some of them have these labels, but most of the time what you're gonna do is just get the patient's label off of the chart and you're gonna put it on here. You're gonna put it in the biohazard bag, and then you're gonna make sure that you write down where you got it. So right radial, left radial, brachial, whatever. You're gonna write down what oxygen they're on. So their FiO2, if they're on a FiO2, or the liters per minute they're on, what device they're on, and if they're on a ventilator, you're gonna write down their vent settings. So you're also gonna note their temperature, especially if they have a high fever or a very low fever, a very low temperature, and you're gonna put that in the machine so it can correct for that. And I believe I've covered everything. Okay, thank you.